Every single day, 80 million adults over the age of 45 sit hunched forward at desks, in cars, on couches, slowly compressing their internal organs without feeling a thing. Not mild discomfort, but serious structural compression, sometimes complete restriction of organ function. And here is what terrifies me after 15 years of clinical practice. Most of them have no idea that the digestive problems, the breathing difficulties, the mysterious fatigue they attribute to aging are actually mechanical consequences of skeletal misalignment that started decades ago. Look at your posture right now, before you do anything else. Most people see a comfortable position, maybe a slight forward lean they assume is normal after years at a computer. I see organ displacement. I see a rib cage that has migrated forward and downward, crushing the space where your stomach, liver, and intestines are supposed to function. I see lungs that cannot fully expand because the thoracic cavity has collapsed by 2 to 3 centimeters. 15 years of clinical practice, and I have watched digestive disorders, breathing restrictions, and chronic fatigue announce themselves through forward head posture and rounded shoulders long before the patient connected their physical position to their symptoms. Subscribe to Dr. Waterling right now and hit that like button. We are working toward building this channel on one principle. Your body is not broken, and the solutions you need cost almost nothing. The healthcare system profits when you stay sick, not when you discover that a single wall exercise performed daily can reverse structural damage your doctor never mentioned was reversible in the first place. Here is what nobody tells you about posture. The conversation always focuses on back pain, neck tension, maybe shoulder discomfort. Those are symptoms, not the actual problem. The actual problem is that when your head moves forward just 5 centimeters ahead of your shoulders, the weight your neck supports increases from 5 kilograms to approximately 12 kilograms. That is more than double the load. But that mechanical stress on your cervical spine is still not the most serious consequence. The most serious consequence is what happens inside your torso when your upper body collapses forward. Your rib cage is designed to create a protective cavity for your vital organs. It is an architectural structure, and like any structure, it depends on proper alignment to maintain internal space. When your shoulders round forward and your head drops, your entire rib cage rotates downward and inward. The front of your rib cage compresses toward your pelvis. The back of your rib cage pulls upward. The result is a reduction in the vertical space inside your torso by anywhere from 2 to 4 centimeters in moderate cases, sometimes 6 centimeters or more in severe forward posture. Now, your organs do not shrink to accommodate that lost space. Your stomach, your liver, your intestines, your diaphragm, they all remain the same size. So what happens? They get compressed. Think of it like this. Imagine a cardboard box filled with organs made of soft tissue. When you press down on the top of that box, the contents do not disappear. They get squeezed, displaced, pushed into positions they were never designed to occupy. Your stomach sits directly beneath your diaphragm in the upper left quadrant of your abdomen. When your rib cage collapses forward, your diaphragm cannot descend fully during breathing, and your stomach gets compressed from above. This creates several measurable problems. First, reduced stomach volume means you feel full faster, often uncomfortably full, even with normal portion sizes. Second, the compression increases pressure inside the stomach, which forces stomach acid upward toward the esophageal sphincter. This is mechanical reflux, acid being physically pushed where it does not belong, not because you ate the wrong foods, but because your skeletal structure is compressing your digestive organs. Your liver, the largest internal organ in your body, sits on the right side beneath your rib cage. It weighs approximately 5 kilograms and performs over 500 metabolic functions. When your posture collapses, the liver gets compressed between your rib cage and your intestines below. Reduced space means reduced blood flow through the hepatic vessels. Reduced blood flow means reduced detoxification capacity, reduced bile production, reduced metabolic efficiency. You feel tired not because you are getting old, but because your liver is literally being crushed and cannot perform its energy-regulating functions properly. Your intestines, roughly 7 meters of digestive tubing, need space to perform peristalsis, the wave-like contractions that move food through your system. When your torso compresses, your intestines get packed into a smaller abdominal cavity. The loops of bowel press against each other. Peristaltic movement becomes restricted. Food moves slower. Digestion becomes incomplete. Bacterial fermentation increases, creating gas, bloating, and the chronic digestive discomfort that most people over 50 just accept as normal aging. But here is where it gets critical. Your diaphragm is not just a breathing muscle. It is a mechanical pump that assists venous return, the process of pushing deoxygenated blood from your lower body back up to your heart. Every time you take a full breath, your diaphragm descends approximately 3 to 4 centimeters, creating negative pressure in your thoracic cavity that literally pulls blood upward through the inferior vena cava. When your posture collapses and your diaphragm can only descend 1 or 2 centimeters, that pumping action weakens dramatically. Blood pools in your lower extremities. Circulation slows. Your heart works harder to compensate. You experience cold feet, leg fatigue, and the kind of systemic tiredness that no amount of sleep seems to fix. This is not a minor inconvenience. This is structural organ compromise with measurable physiological consequences. And here is what makes me furious. When you walk into a doctor's office complaining about acid reflux, bloating, chronic fatigue, and poor circulation, what do you get? A proton pump inhibitor for the reflux, a probiotic recommendation for the bloating, maybe a referral to a cardiologist for the circulation. At no point does anyone ask you to stand up, look at your posture, and consider whether your skeletal alignment is mechanically crushing your internal organs. The system you rely on for your health is not built to identify root causes. It is built to prescribe medications for symptoms. There is no billing code for postural assessment. There is no pharmaceutical revenue in teaching you a wall exercise. Your next appointment will not include anyone measuring the forward displacement of your head or the degree of thoracic kyphosis, the medical term for the rounded upper back that compresses your organ cavity. Let me tell you about Martin. Martin was 58 years old when he came to my office. He had been experiencing severe acid reflux for 3 years, chronic bloating that made him avoid eating before social events, and fatigue so profound he could barely stay awake past 8 p.m. despite sleeping 8 hours a night. His previous doctor had prescribed omeprazole for the reflux, suggested eliminating various foods for the bloating, and ordered blood work for the fatigue. Everything came back normal. The implicit message was, "You are just getting older, learn to live with it." When I had Martin stand against a wall, his head was 11 centimeters forward from the vertical plane of his shoulders. His shoulder blades could not touch the wall without him forcing his chest forward unnaturally. His rib cage had rotated so far forward that I could measure a 4-centimeter reduction in the vertical distance between his sternum and his pubic bone compared to optimal alignment. I told him, "Your organs are being compressed by your skeleton. Your symptoms are mechanical, not metabolic. We are going to fix your structure, and your symptoms will resolve." Martin looked at me like I had just told him the earth was flat. He said, "My posture is causing my reflux?" I said, "Yes. Your collapsed rib cage is compressing your stomach and mechanically forcing acid upward. We are going to restore the space inside your torso, and the reflux will stop because there will no longer be mechanical pressure creating it. We began the wall exercise protocol that I am about to teach you. Martin performed it every single morning for 5 minutes. Within 1 week, he reported that the reflux episodes decreased from nightly to 3 times that week. Within 3 weeks, the bloating had resolved completely. By the end of 2 months, his energy had returned to levels he had not experienced in years. He stopped the omeprazole. He reintroduced every food he had eliminated. The problem was never his stomach acid or his diet. The problem was that 30 years of sitting had compressed his torso and crushed his organs, and nobody had ever looked at his posture and made the connection. Now, the recovery protocol. This is not stretching. This is not yoga. This is structural recalibration, using the wall as a fixed reference plane to retrain your neuromuscular system to hold your skeleton in proper alignment. The exercise takes 5 minutes. You need a flat wall, nothing else. No equipment, no special clothing, no gym membership. Here is exactly how to perform the Wall Angel exercise, the single most effective postural correction movement for reversing thoracic kyphosis and decompressing your organ cavity. Stand with your back against a flat wall. Your heels should be approximately 10 to 15 centimeters away from the wall, not touching it. Press your entire spine against the wall. Your lower back will have a small natural curve, a gap of about 2 to 3 centimeters between your lumbar spine and the wall. That is normal. Do not flatten it, but your mid-back, your thoracic spine, should make contact with the wall. Your shoulder blades should touch the wall. The back of your head should touch the wall. Most people cannot achieve this position initially. If your head does not reach the wall, that is your baseline. That is the measurement of how far forward your posture has shifted. Do not force it. Forcing creates neck strain. Instead, gently draw your chin backward, not downward, but straight back, like you are trying to create a double chin. This movement, called cervical retraction, repositions your head over your shoulders rather than in front of them. Now, raise both arms and bend your elbows to 90 degrees, like you are making a goalpost shape with your arms. Your upper arms should be parallel to the floor. Your forearms should be perpendicular to the floor, pointing toward the ceiling. Press the back of your hands, your wrists, your elbows, and your upper arms against the wall. This is your starting position. From here, slowly slide your arms upward along the wall, straightening your elbows as much as possible, while keeping every point of contact, hands, wrists, forearms, elbows, upper arms, all pressed against the wall. Most people can only raise their arms 20 to 30 degrees before one of those contact points pulls away from the wall. That is fine. Go as far as you can while maintaining contact. When you reach your maximum range, pause for 2 seconds, then slowly slide your arms back down to the starting position. That is 1 repetition. Perform 10 repetitions. The entire sequence takes approximately 3 minutes. Here is what you should feel: a strong stretching sensation across your chest, specifically in your pectoral muscles, the muscles that have been shortened and tightened by years of forward posture. You should feel your shoulder blades squeezing together in the back. You should feel muscular effort in your mid-back between your shoulder blades as the rhomboid and middle trapezius muscles engage to retract your shoulder girdle. You may also feel mild discomfort, not pain, but discomfort in your shoulders or upper back. That is normal. Those muscles have been overstretched and weakened for years. They are being asked to work in a range they have not accessed in decades. Discomfort means you are working in the correct range. Pain, sharp or stabbing, means you are forcing beyond your current capacity. Stop immediately if you experience pain. After completing 10 repetitions of the Wall Angel, remain standing against the wall with your arms at your sides. Focus on maintaining contact with your mid-back, shoulder blades, and head against the wall. Take 5 slow, deep breaths. With each inhale, consciously expand your rib cage laterally, outward to the sides, not upward toward your shoulders. With each exhale, maintain the expanded position. Do not let your rib cage collapse. This breathing pattern reinforces the expanded thoracic cavity you just created with the arm movement. After the breathing sequence, step away from the wall and notice how your body feels. Most people report an immediate sensation of being taller, of having more space in their chest, of breathing more easily. That is not psychological, that is structural. You have just mechanically lifted your rib cage, expanded your thoracic cavity, and decompressed your organs. The feeling is real because the physical change is real. Now here is the critical part that determines whether this works or fails. You must perform this exercise every single day, not when you remember, not when your back hurts. Every single day, preferably first thing in the morning. Why? Because your neuromuscular system has spent 30 years learning to hold you in collapsed posture. 5 minutes against a wall does not erase 30 years of patterning. You are retraining your nervous system to recognize proper alignment as the default position. That requires daily repetition for a minimum of 8 to 12 weeks before the pattern stabilizes. During the first week, expect to feel muscular fatigue in your upper back and shoulders. You may feel like your posture is actually worse because you are now aware of how much effort it takes to maintain alignment. That is progress, not regression. You are waking up dormant muscles. During weeks 2 through 4, you should notice that maintaining upright posture throughout the day requires less conscious effort. Your head will naturally sit farther back over your shoulders. Your chest will naturally sit higher. These are signs that your nervous system is integrating the new pattern. By weeks 6 through 8, the digestive symptoms should show measurable improvement. Reflux episodes should decrease in frequency and severity. Bloating should reduce noticeably. Energy levels should increase as your diaphragm regains full excursion and your organs decompress. By weeks 10 through 12, most people report that the exercise feels natural, that their postural awareness has become automatic, and that symptoms they attributed to aging have largely resolved. Now, the most important thing I want you to hear. If you have a history of shoulder injury, rotator cuff tears, shoulder impingement, or frozen shoulder, do not push through pain during this exercise. Pain in a previously injured joint is not weakness to be overcome. It is a warning signal with clinical validity. Modify the range of motion. Go only as high as you can without pain. Progress gradually over weeks or months. The goal is structural restoration, not injury aggravation. If you experience dizziness during the wall breathing portion, you are likely hyperventilating. Slow your breath rate. 5 breaths over 1 minute, not 5 breaths in 20 seconds. The dizziness will resolve with slower breathing. If you have severe thoracic kyphosis, a significant hump in your upper back, you may not be able to touch your head to the wall initially. That is expected. Use a small pillow or folded towel behind your head for the first few weeks. As your spine extends and your posture improves, reduce the pillow thickness gradually until your head touches the wall directly. Here is your complete daily protocol. Morning, immediately after waking. Before breakfast, stand against a wall and perform 10 wall angel repetitions followed by 5 breath cycles. This takes 5 minutes. Afternoon, if you work at a desk, set a timer for every 2 hours. When it goes off, stand up, walk to the nearest wall, perform 5 wall angel repetitions. This takes 2 minutes and prevents the postural collapse that occurs during prolonged sitting. Evening, before bed, perform another 10 wall angel repetitions with 5 breath cycles. This resets your alignment before sleep and prevents overnight compression. Additionally, become aware of your sitting position throughout the day. When you sit, imagine a string attached to the crown of your head pulling you upward. Keep your shoulder blades gently retracted, not squeezed together tightly, but drawn slightly backward. Keep your chest lifted, your rib cage expanded. Every hour, take 3 deep lateral breaths, expanding your rib cage outward to the sides. This prevents the gradual collapse that occurs during sustained sitting. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Let me be very clear about what this exercise cannot do. It cannot reverse severe structural deformities like advanced osteoporotic compression fractures. It cannot fix scoliosis, lateral spinal curvature. It cannot treat herniated discs or spinal stenosis. Those are structural pathologies requiring medical intervention. This exercise addresses functional postural deviation, the collapse that occurs from muscular imbalance and habitual positioning, not from bone disease or disc pathology. If you have been diagnosed with osteoporosis, you can still perform this exercise, but with caution. Do not force your spine into extension. Move gently within comfortable range. The wall provides a safety boundary that prevents prevents excessive movement. If you are currently experiencing acute back pain, sharp stabbing pain that worsens with movement, wait until the acute episode resolves before beginning this protocol. Acute pain indicates tissue inflammation that needs rest, not exercise. This is a corrective protocol for chronic postural dysfunction, not a treatment for acute injury. Now, why does conventional medicine never mention this? Because postural assessment takes time. It requires looking at the whole patient, not just the presenting symptom. It requires understanding biomechanics, not just pharmacology. And most importantly, it generates no revenue. There is no prescription to write for wall angels. There is no procedure to bill. There is no follow-up appointment needed to monitor medication side effects. When you present with reflux, the system gives you acid suppression. When that creates nutrient malabsorption, they add supplements. When both together cause bone density loss from reduced calcium absorption, they recommend bone density scans and bisphosphonate medications. At no point does anyone step back and ask, why is acid being forced upward in the first place? Could the answer be mechanical rather than metabolic? The healthcare industry is not built to keep you healthy. It is built to manage your symptoms with interventions that generate ongoing revenue. Prevention generates no revenue. Structural correction that you can perform at home generates no revenue. That is why your next appointment will not include a wall, a postural assessment, or any discussion of how your skeletal alignment affects your organ function. But you now know. You know that your digestive problems, your breathing difficulties, your chronic fatigue may not be metabolic disorders requiring medication. They may be mechanical consequences of skeletal misalignment compressing your organs. You know that 5 minutes against a wall every morning can begin reversing 30 years of structural damage. You know that your body is not broken, it is compressed, and decompression is entirely within your control. Subscribe to Dr. Waterling right now if this information helped you. We are building this channel to give you the information that no clinic appointment will provide. Share this video with someone you care about, a parent, a friend, someone who complains about digestive problems or fatigue and has never considered that their posture might be the root cause. You may have just given them a real chance to resolve symptoms they thought were permanent. Your organs need space to function. Your ribcage is designed to provide that space. 30 years of forward posture has collapsed that space. One wall exercise performed daily restores it. That is not a metaphor. That is not wellness philosophy. That is structural mechanics applied to human anatomy. Start today. 5 minutes. One wall. Your body will remember what proper alignment feels like, and your organs will thank you by functioning the way they were designed to function before you spent 3 decades crushing them.